Nigeria, the most populous nation in Africa, is facing a variety of social, economic, and political challenges. The effects of climate change, flooding, poverty, and insecurity have displaced millions of Nigerians from their homes, forcing them to rely on help from others for food and shelter. According to United Nations Office for the Coordination of Humanitarian Affairs, about 8 million people in Nigeria required humanitarian assistance, with 4.4 million targeted for aid. This gesture by humanitarian groups and individuals are driving changes and bringing hope to the vulnerable and the displaced. Whether displaced by bandits or floods, Professor Yahya Tankobaba of Usman Danfodio University said timely humanitarian interventions and community engagements are crucial in disaster response.
Time in recent period, the humanitarian efforts and humanitarian activities represent one most reliable, means of interventions that actually reach the most vulnerable people in the society. We know the government exists, and the government is actually structured and established to cater for the needs, the welfare, and the security of the people. But oftentimes, the government is constrained by limited resources, and of course, such limitation in resources is a huge challenge for government to actually respond most appropriately to the needs of the people, particularly in disaster, in the issues of disaster. The capabilities of government, the capacities of government, the resources of government are not quite adequate to respond, adequately and appropriately to the plight of the people that are actually affected by disasters. And of course, after government, we know the private sector also exists to corporate social responsibilities. The private sector is also expected to touch the lives of the people, to intervene and to come to the rescue of the people, particularly in terms of critical needs in disaster and emergency period.
The humanitarian work is a collective effort of all the community, all the citizens, to support government and mobilizing resources, taking ownership, and then also improving the quality of project awarded by the government through ownership. If the community take ownership, they have to monitor, they have to take ownership, they have to ensure maintenance, and as well, community have to mobilize their own resources to leverage the resources of the government.
In Sokoto, residents of Isa and Sabon Birni who have been displaced by bandits said they have been living on assistance from humanitarian organizations and philanthropists.
We are deeply grateful to the organizations that provided us with food assistance for 5 months. Although the support recently came to an end, we truly appreciate their kind gesture. Their intervention was a lifeline for us, and we relied heavily on it to survive. We commend their efforts and hope that similar support will continue to be available to us in the future.
Alhaji Sani Umar Jabi, who is well known in the humanitarian and development space, noted that humanitarian work has enabled his community to provide vital services.
Community have a very robust structure, robust engagement, robust commitment, bringing everybody. So that means we have the inclusion is also solution to most of the problem. But when there is segregation or neglecting some segment of society, so we cannot achieve what we achieve. So today we have a very strong committee in the healthcare. We have a very strong committee in the education, and above all, if you go to security, our vigilante is very capable. In the territory of my Gagi district is well safe. and the vigilante is working well, 24 hours. And then I believe all the sector, this attribute of good leadership, an attribute of ownership and sustainability by community, and also engaging and respecting right of every citizens, irrespective of political inclination, irrespective of religion inclination, irrespective of sex. So we are working together and we are unique. Our support is very essential.
Humanitarian organizations have provided protection services, including psychosocial support and referral services to unaccompanied children and victims of gender-based violence. Emergency healthcare services have been established to treat severely malnourished children and provide essential medicines.
Yes, the impact of the health humanitarian services is enormous because, in summary, it is saving lives. So you have children that without those sensitization, without provision of those nutrients, without provision of those food, these children will have had malnutrition, become stunted, and even die. And then also for the women, it is saving their lives because they do not know where they are going to get these healthcare services. So through what we do, we provide those services to them, we provide health education and health talks to them, and this is also saving their lives. And then one important functions of these health humanitarian services is that through the health education that we do, it prevents spread of diseases, because when you have people that are overcrowded in a community and then there is no proper hygiene, they are liable to have the spread of infections or diseases, outbreak of infection. So with health education, health talks, they are able to practice some health hygiene which prevents them from getting infected.
Experts agree that humanitarian work remains vital for rural communities, promoting sustainable livelihood and economic empowerment.
We can say in this period is a lifeline as far as the livelihood of the people is concerned. More often than not, the government also needs most times to collaborate with the humanitarian platforms in the implementation of its own programs because of the in-depth knowledge those humanitarian platforms have with the community and the level of acceptance that actually these communities have on this humanitarian platform. Therefore, collaboration between government, the private sector, and the humanitarian platforms or the civil society organizations are so important for the success of even governmental policies, programs, and projects. So we cannot actually, assume to exist in this world of ours without humanitarian interventions, or without humanitarian platforms, or without provision or existence of these very particular organizations that are charitable, that are humanitarian, that are social in nature, because they provide not only financial resources, but they also provide the social capital that is actually needed for the success of policies, for the success of programs, and for the success of projects that requires huge financial resources.
Jabir Abubakar Shinkafi, Executive Director of Al-Yatim Charity Initiative, highlighted that humanitarian aid has supported many less privileged individuals, particularly during crises like the recent floods that ravaged Maiduguri and other parts of northern Nigeria.
If we take the case of Maiduguri floods, one of the amazing part of the partnership that was initiated during the flood in Maiduguri, we have seen a lot of organization, international organization, partnering with agencies like SEMA, NEMA, and of course military to rescue the victim. One of the key factors of a good partnership is through collaboration with the state government and of course the international organization. When the flood started in Maiduguri, we have seen a lot of international organizations coming in Maiduguri to bring their support, from interventions like shelter, food relief items, and of course providing social psychological support to the people affected with the flood actually.
In 1999, National Emergency Management Agency (NEMA) was established by Act No. 12. Additionally, in the year 2000, State Emergency Management Agency (SEMAs) were established in various states in Nigeria to offer humanitarian assistance to those in need.
The government is doing a lot, but there is needs for more hands to come to these people. It's because they were here not because they wanted to. It's just that the situation warrant them to, and we are hoping maybe by the time this issue of insurgency, maybe they will be able to go back to their various places.
With the crisis in Nigeria, Boko Haram in the northeast and banditry in the northwest, many non-governmental organizations have continued to offer humanitarian assistance. Margaret Amadu is the program officer of Bakita Initiative JDPC Sokoto.
One major area we have offered assistance to community members include, not limited, but include first and foremost livelihood support, where we provide relief materials and food and non-food items to these community members. And then we're not doing it alone, we're doing it in partnership with other partners, other organizations, other donor agencies who are supporting us to see that we really come to the aid of communities in need, especially those communities who are hosting IDPs, internally displaced persons, within and outside Sokoto State. So this is one area we are offering assistance to community members.
We train or empowered like 400 women among 1,200 host community members, mostly women. Almost 800 are women. We have trained them with different skills, how to make soap, that is vim, soap making, perfume making, etc., etc. So we have trained them and we give them certificate and even a startup grant for which they can sustain their livelihood.
Acting Director of Humanitarian Affairs at the Ministry of Humanitarian Affairs and Social Development in Sokoto State, Salisu Abubakar, acknowledged the significant impact of humanitarian services in addressing Nigeria's complex humanitarian crisis.
Speaking, it helps a lot, considering the fact that if you see how many thousands of IDPs that we have within the metropolis and across our almost 23 local government, because when you see it from the onset, this issue of IDPs came somewhere around, I think, 2019, 2020, when this banditry started attacking our eastern part of the state, like Gada, East, Sabon, Birni. So there are a lot of activities, or shall I say, there are a lot of interventions that we used to receive from international partners and from philanthropists within and around Sokoto State. Well, it helps a lot because considering the fact that when somebody is an IDP and when he came from, maybe he left his comfort zone and came somewhere he sees maybe he will seek shelter, there are a lot that he needs.
In spite of the effort by humanitarian organizations to make an impact, there are some challenges that need to be looked into.
Key challenges, one of which we have identified so far is insecurity. This is one key challenge we are facing or we've encountered so far. There are communities that are hard to reach, so it's difficult to assess these communities because of insecurity. So then there are other challenges we've also encountered, which is low literacy level. So you have to do a lot of awareness creation and sensitization before you go ahead to offer the relief assistance that you want to give to the community members, so that they really come to understand the value of why you are coming in to assist them. So these are one of the key challenges we have experienced so far working.
We as partners, sometimes there are some locations that we don't have security clearance to go due to the insecurity, but the government officials are there. Whenever you hand over the issue to the government, the items to the government, to some of the government officials, not all, may divert the items to their own use. So most of the victims are not receiving those support.
Yeah, I think one of the major challenges these humanitarian platforms face today is the legal environment, the policy environment that exists in the area in which they operate. First and first, communities cannot be accessed without the tacit approval of the government. The government have frameworks, have governmental institutions and structures that are put in place to actually grant approvals for these platforms to operate. More often than not, these groups will take, because of the bureaucratic bottlenecks that exist in the MDAs, in the government agencies, it takes them a very long period of time before they get the clearance and the approvals to work in communities. And some of these humanitarian platforms will try over and over again without luck, and they will leave. And this is a huge challenge. So there is need to streamline those policies and those laws, those rules that usually screen and grant approval to this humanitarian platform. Secondly, there also exists a challenge for humanitarian platforms that do not have the knowledge of the environment. Environment is quite key for the success of any intervention, for the success of any policy, for the success of any program, whether governmental or non-governmental. And now bigger humanitarian platforms that come to intervene in communities, they are often faced with the challenge of disapproval and rejection on the basis of norms, values, and cultural preferences that actually exist in those communities. But what is required of those bigger platforms to be successful in their operations and in their interventions is collaboration with local NGOs. In virtually all communities, you may have local organizations and NGOs that work in those communities. The best way, after getting approvals and the legal, and policy grants for you to operate in a particular state, what is next to be done is to look out for those local, well-established local NGOs that work in the communities, that have high rate of acceptance in the community, forge collaboration and partnership with them, discuss your ideas and your strategies of intervention, you discuss the issues and what areas which areas do you want to intervene, and the local NGO will give you information about whether or not a particular strategy that will come with this intervention works or it doesn't work. And it will also give you a clear picture of what strategies you require to ensure that your intervention, is accepted in those communities.
Experts concur that humanitarian services have saved countless lives and alleviated suffering.
When you come to talk of other areas of humanitarian assistance that community members have received so far, you will realize that it is something that the much needed encouragement that these community members need. So these are community members who don't really have, they don't have that direct touch with their legislators, right? So we as development partners come in to bridge that gap between them and their legislators. So these are other areas where we're working to see that we better the lives of citizens and complement the efforts of government.
most of the countries that developed countries today, is a private sector fooling government, not government fooling private sector. But if you come to sub-Saharan Africa, Nigeria, or northern Nigeria in particular, you can see both the private sector, government, both the contractors, everybody depend on government. You can see how our youth today are corrupt, looking for white-collar job. They can sell their farmland, they can sell whatever, look for offer in the local government. Somebody living in Port Harcourt, doing his mini PT business in Port Harcourt, but he want to use money to buy offer for him to be receiving a lot of 8,000, which is, I think, is hopeless. So as a community, when they measure their ability to execute some community development projects that are life-saving, so they can do a lot in leveraging the government, in supporting government to actualize their potentials. So I believe the government and the community have vital role in ownership and sustainability for the project, and also mobilize their resources to establish also their own community-based self-help project that will help also to support government, part of the mandate of the government in ensuring access to healthcare, access to basic education, access to security and safety, access to agriculture facility and everything, and overall access to fundamental human right to live, a right to participate, a right to also engage in the governance and what have you.
Humanitarian work to the society is very enormous, because one of the major challenges of people, for example, that are displaced or people that have problems is healthcare service delivery. And this kind of population of people usually suffer from many diseases. For example, because the places they live are congested, so they are liable to have diseases and infections that have to do with overcrowding. For example, they are liable to have malaria, they are liable to have tuberculosis, they are liable to have infant diseases that can have dangers on these children. So what we do in terms of healthcare provision to the humanitarian communities is to ensure that we provide services. The first important services is health awareness and sensitization, to tell them about how to implement health related practices. For example, healthy behaviors, healthy living, and then even healthy nutrition. So these are some of the areas we create their awareness, so that they will know that they need, for example, mosquito nets. They need to have a clean environment. They need to put more effort in personal and environmental hygiene.
The ongoing humanitarian effort in Nigeria demonstrates the critical role of humanitarian work in societal development, saving lives and reducing suffering and helping people get their lives back on track.